The numbers keep rising. Argentina, like the rest of Latin America, is suffering a second wave of COVID-19's infections and deaths. The government has imposed a further 3 weeks of new, tougher lockdown restrictions, a nighttime curfew and schools returning to online classes. The authorities say their main aim is to relieve the strain on hospitals.
Today, the health system can't cope with another patient, not one more. We've reached our limit. The number of contaminated patients, even if it doesn't go up, has reached breaking point. It's overflowing. We can keep extending measures every 15 days or 2 more years, but what we've got to do is test and vaccinate.
The arrival of vaccines has been slow and sporadic. The Argentinian government says it's doing all it can to find new supplies, but so far only a small percentage of people have had both jabs, the elderly and those with already serious health conditions. In the meantime, the only other option is to keep asking its people to be patient and cooperate.
People need to be more aware and realise that our hospitals are full, that the health workers are exhausted, and we all need to understand what we as citizens need to do to fight this.
But there have been demonstrations against the government measures. The Argentine economy, already facing severe difficulties before the pandemic, has been hit hard.
We're trapped in a situation which we understand is for our own good, but we've got no help from anyone to help us fight through the pandemic.
The constant request to pack up early, stay indoors, keep your distance, have become for many an annoying drone in the background, even though they understand that it could be a matter of life or death. 3 million infections is a grim statistic in a horror story that also includes growing unemployment, homelessness and poverty. Figures that will only keep rising until the coronavirus is brought under control. Schweimler, Jazeera, Buenos Aires.